Good morning, everyone. It is finally Friday. It's March 4th. Welcome into the Morning Medical Update. Thank you so much for joining us right here on Facebook, YouTube, and now on Twitter. Coming up this morning, how one young man became a hero to a stranger, all thanks to something simple that he did years ago. We'll tell you all about that. And we're joined this morning by Dr. Joseph McGuirk. Why Be the Match, why that program is so vital for his patients, and how you too could save a life and be the match for someone around the world. In medical news headlines this morning, another option for those considered obese. A new injectable treatment called semaglutide has been recommended for use in the United Kingdom. It mimics a hormone the body releases to make you feel full. In studies, those on this treatment lost 15% of their body mass. New insight into what happens in the brain as you are dying. Researchers recorded the brain activity of an 87-year-old man who suffered a heart attack after a traumatic brain injury. The article in Frontiers in Aging Neuroscience found that during the transition period to death, the human brain experienced a surge in brain waves before declining. Today is National Wear Blue Day to help raise awareness for colorectal cancers. Colon cancer is the third leading cancer among men and women and the third leading cancer-related death in the U.S. So wear your blue today, and don't forget you can help fight against colorectal cancer by clicking on that QR code right there. That will take you to the KU endowment page where you can donate to help support research. It will also help honor Rob McGee, the owner of Q39 Barbecue, who lost his battle with colon cancer. Q39 is also donating part of its proceeds through the month with a special on its menu. Get your questions sent in to us this morning on YouTube, Facebook, and at the Medical News Network, and on Twitter. You can find links to those right there on your screen. Now, let's get to Dr. Dana Hawkinson. He's Medical Director of Infection Prevention and Control. He's got our COVID count this morning. Happy Friday to you.
Yeah, happy Friday.
Hi.
Yeah, we know our guest from earlier in the week, Dr. Ashcraft, would really appreciate today, as he does that every day, fight colon cancer. So hats off to him and everybody who's going through that as well. Today, in the health system, we do have 33 active infections, with 5 in the ICU and 2 on the ventilator, still 63 in the recovery period. So a total of 96. We're under that century mark. That's good. I think overall we have continued to see a decrease in our rates, in our numbers of hospitalization, and that continues to be a good thing. I expect for right now we don't see any new other variants that have been identified that are creating surges, so we are still I think going in the right direction, and hopefully we can continue that. It is going to be warmer, so if there are gatherings and things this weekend, please try to get outside. I know later on the weekend there may be rain, but hopefully the warm weather will help also decrease any spread, because we know the virus is still out there as well.
All right, some good news heading into the weekend. Thanks, Doc Hawk. Do we have any reporter questions on the line today? We do not, so we're going to keep rolling ahead. Every 3 minutes, someone in the U.S. is diagnosed with a blood cancer. Here's how you can help, though, be the match. Click the QR code right there on your screen. Inside the link, you will be asked several questions. If you meet the criteria, it's simple. You're going to be sent a swab kit in the mail. You swab your cheek, you send it back, and now you're registered in the worldwide database. And that's exactly what our guest this morning did. Levi swabbed his cheek years ago, and then one day was surprised when out of the blue, he got a call to save a life. We're going to talk with him next, but here is his adventurous story.
To whom I've matched, I hope this letter finds you well and in high spirits.
26-year-old Levi Cornelli shares these words he wrote down.
I never truly expected for this opportunity to come to fruition.
Intended for someone he's never met. Not yet, anyway.
To be quite honest, it could not have come at a better time.
But the meaning behind those words began 6 years ago, here in Chicago, when a friend invited Levi to a Be the Match donation event. Be the Match is a nationwide bone marrow registry.
I was like, well, why not? It's a good opportunity to potentially just give back.
But what started as a simple cheek swab years ago turned to reality when he picked up his phone a few months ago.
It made me realize just how much life can change based on a single phone call. Get a phone call saying, hey, just not sure if you remember this from a long time ago, but you actually were just matched with somebody and we wanted to see if you were interested in actually donating.
He was.
So at that point, I was like, you're right, I did do that.
The donation would take place in Kansas City. Be the Match coordinators told Levi he would need to bring someone along with him. For Levi, there was only one person, his brother Evan, who flew in from Tampa Bay, Florida.
I'm just so happy to be here.
But their trip took a detour the morning Levi was scheduled to donate at 6 a.m. at the University of Kansas Cancer Center.
Alarm clock didn't quite go off, and then we're trying to order the lift, but unfortunately there's just no lifts available at that point, so I'm trying to scramble and figure out what am I gonna do. I have to get to the hospital. I remembered that there were the bird scooters around. So I figured, well, we can just ride those for as long as we can. And then we found the end radius of it about a mile outside the hospital still, so we had to ditch those and then just run the rest of the way to the hospital. And it's like, okay, now we gotta run, time to sweat. And then I went to the wrong hospital. So then I contacted my Be the Match representative and she got me the right address. At that point, we were able to find a lift to actually get to the hospital.
Roadblocks? Not these two, not this day.
I knew I was here for a reason to just, get here and donate, and I was like, not gonna let anything stop me.
You finally make it here after your crazy trip, and then they're wheeling you back. What was it like knowing that you were going to go through these doors and help another person, live a good, healthy life?
Honestly, it was just really exciting. I was just more eager than anything else that I finally made it here, and just really excited the fact that I actually had a chance to make a difference in somebody's life.
The procedure to donate took about 3 hours. A little tired after, but Levi felt pretty good and was ready for more Casey sightseeing with Big Brother, who now looks up to Levi.
I am one proud brother, without a doubt. This guy is just a rock star. We've made so many memories on this trip. I will absolutely never forget, and I'm going to cherish them for a very long time.
So how cool would it be to maybe meet that person or be able to talk to that person one day?
I would be really excited.
He'll have to wait a year to make contact with his recipient.
This experience has shown me just how much I can help, and I no longer shy away at challenges but welcome them.
But in the meantime, he jots down his feelings for that person, wherever and whoever they might be.
I understand that I am the one donating here, but I cannot help but thank you for this chance to change my own life. I can only pray that I can return the favor. Be well and stay healthy. Sincerely, your Match.
And Levi is joining us this morning from Chicago. Good morning to you.
Good morning.
Is that how you remember that big old story?
Yeah, just pretty much exactly that.
It was quite an adventure. I loved sharing it and telling it and getting to know you. We're going to talk more about that. I also want to bring in Dr. Joseph McGuirk, Division Director of Hematologic Malignancies and Cellular Therapeutics with our Cancer Center. And, that's quite dedication, Dr. McGuirk. Do you not agree?
That's incredible perseverance and determination. Levi's a hero, what a great story.
Well, and Levi's exactly the kind of people that that you love. He is exactly who helps your patients.
Absolutely, it's amazing every time. After 32 years of doing transplant and seeing donors, heroic donors like Levi, I never tire of their incredible determination, dedication, and heroism.
Because you see one side of the story. Here at the hospital, we hear and see this side, but we don't often get to meet the heroes on the other side.
That's
where
right.
This all began. Levi, again, love your story. Nothing was going to keep you from your mission. I think a lot of people would have just said, forget it. It wasn't meant to be. I'm telling you what. How are you feeling? How are you feeling?
Honestly, I feel just perfect. There's no side effects, nothing. I feel back to just good as I was before.
So the clock is ticking on when you might be able to reach out to your recipient. I know they have to wait a year. Isn't that right, Dr. McGuirk?
Yes, that's right.
And the reason for that is?
A lot can happen in that year time period. The recipients often are cured of their disease, but not always, and some suffer greatly, and so there are a lot of sensitivities there.
Makes sense. But Levi, what does it feel like knowing that out there in the world, you helped save someone that you didn't even know?
It's honestly a really cool experience. It's unbelievable. And I actually did send them that letter too, and I actually did get a letter back at one point. So they did reach back out to me and said that they are in high spirits and wanted to thank me very much for the donation that I did.
Fantastic. Well, hopefully we'll get a reunion one of these days very soon. I'm glad you got that letter because that's got to make you feel really, really good. I want to talk with Dr. McGuirk a little bit about Be the Match and why it is so vital to patients. Let's just kind of dive into exactly what it is, and then we'll talk about the process on how you can get registered.
You bet, absolutely. Be the Match is a registry of now almost 40 million people worldwide who, like Levi, are willing to donate their stem cells or their bone marrow for someone in need, like Levi's recipient. For many patients with blood cancers, their best chance of being cured of their disease is undergoing a stem cell transplant like that which Levi donated to. And we have an incredible number of patients in need. 12,000 of these types of transplants are done on a yearly basis in the United States. Only, and quite remarkably, only about 25 to 30% of patients in need of a transplant will have a brother or sister who's a perfect match.
And it's the brother or the sister, it's the sibling
That's
who
correct.
is the best. It's not a parent, it's not,
That's
it's
correct.
not a child, it's
That's
a
right.
sibling. Why is that?
We do parental and child transplants, but they're more complex and have more risk associated with them. The best donor is a perfectly matched donor. We're not talking about the blood system, we're talking about the immune system, specific molecules. And the reason for that is when those molecules are mismatched and they're not a perfect match, there's an increased risk of complications that can go in two directions. One, Levi's T cells can attack our patient and cause something called graft versus host disease, common cause of illness, and sometimes we lose patients from that complication. And the other direction, the recipient's T cells can survive, and if they see that mismatch, if Levi were a mismatched donor, for example, attack Levi's cells and reject that graft. So the better matching, the better outcomes for our patients.
Yeah, because you don't want to make the situation worse and now have a new problem with the donor.
That's absolutely right.
So tell us a little bit about the difference between solid tissue cancers and bone cancers. And we just recently opened 3 floors at our Cambridge Tower. I think we're going to try to show some video of that. And this whole area was designed specifically to help protect the immune systems of these patients. Help us understand why blood cancer patients going through treatment are so immunocompromised.
Absolutely. A critically important question. So people who undergo solid organ transplantation have an organ, a lung, for example, a heart, kidney, that has failed them, but generally their immune system is working quite well. In patients with blood cancer, the cancer is of their immune system, some element of their immune system. So already before we've even started the process, these patients are profoundly immunocompromised and have difficulty fighting infections. And so that's a common cause of illness and sometimes death in these patients. In addition, to get rid of their cancer oftentimes requires a stem cell transplant, and a stem cell transplant is like a solid organ transplant in that although it's a liquid organ, it's a complicated organ. Mm-hmm. Our bone marrow stem cells give rise to all of our blood elements and our entire immune system. In our patients, bone marrow stem cells or their descendants are cancerous. So we give radiation and chemotherapy or chemotherapy alone sometimes to destroy entirely that cancer, but we also, as collateral damage, destroy their immune system. And in part, we intend to do that because we don't, again, want it to survive and recognize Levi's cells as foreign and attack them and reject them. So we completely destroy the patient's immune system, all their blood-forming elements, and make them the boy or the girl in the bubble for some time period. So they don't have any immunity on board. And it will take time after we transplant Levi's stem cells into the patient for them to regrow this new immune system, reconstitute their immune system, and they're highly vulnerable during that period. So as you mentioned, through a kind gift from the Sunderland Family Foundation, we recently opened a $70 million inpatient 100-bed unit, state-of-the-art in the nation, second to none unit. The entire unit has special filtration and a lot of protective measures to keep these a boy or girl in the bubble patients out of harm's way.
Yeah, the filtration system is like one of the big features. You can't see it, but it's really key to making this a safe space for these patients.
It most certainly is. That's absolutely right. And lots of measures. Just getting back there is going through multiple sets of doors and hand washing and reading a lot of signage, et cetera, to keep them safe.
Okay, we're going to talk more about Be the Match. I want to get back to Levi. And again, you can click on that QR code there on your screen. It'll take you to the Be the Match site so you can find out if you can donate or swab. So the process to swab, quite easy. Levi, I want you to tell us a little bit about what you remember, because it was quite a ways back before you got that phone call. And as we saw from the video, the challenge to donate wasn't so easy, and you do have to go through a procedure, which I want you to tell us about that. But just quickly, Levi, tell us a little bit about how easy it was to swab the cheek and register.
Yeah, so I was just on our college campus at Michigan State, and all we had to do was just walk in. There was a little form you had to fill out, do probably 5 minutes in and out the door of a cheek swab. So it was very simple and easy.
Was there any hesitation when you got that phone call that you kind of didn't remember that you'd even done it, and then you're like, okay, I did that? Was there any hesitation? Did you have a lot of questions, or was it like, all right, I did it, let's do this thing?
There was definitely the moment of, oh my goodness, I can't believe I forgot about that. But once I got the call, I was like, well, I mean, there's no choice. I'm going to do this.
Well, how exciting. Yeah, you get the call to duty to help someone out. It would be hard to say no. And what an adventure you have. You said this changed your life. You said it came at the right time. What did you mean by that?
Well, I mean, during COVID, everyone kind of gets in their slumps and all that. And honestly, just the chance to help somebody else was just, I don't know, the gift that you just kind of needed to see and just, I don't know, live out. And to be honest, it just changed my life for the better. Hard to describe.
I love that. I know you get emotional thinking about it, and we can see that. So, and I know that it brought you and your brother close together, and you're changing your life and someone else's. So, Dr. McGuirk, I want to talk to you a little bit about the procedure. So you swab a cheek, that seems easy. But when he came, he had to go in, he went into the operating room. It was about a 3-hour procedure, but what's actually happening when he goes behind those doors?
Absolutely. There are two ways to donate the stem cells. One is through the peripheral blood. Patients receive a protein shot that stimulates the stem cells to come out into the blood. We use a catheter, and that's an outpatient procedure and doesn't require the operating room. But there are some particular risk associated with that type of transplant for the recipient. Again, this problem, graft-versus-host disease. There are fewer cells called T cells that cause graft-versus-host disease in the bone marrow, so sometimes a bone marrow stem cell collection in the operating room is preferable, and that was the case for Levi. And so Levi has to undergo rigorous testing to make sure he doesn't have an active infection or any medical problems that would preclude him from safely undergoing a bone marrow harvest or peripheral blood stem cell donation. The last thing in the world we want to do is put a normal, healthy person at undue risk to help our patients. So we have to look out for the well-being of the donor, of course. And then they undergo a general anesthetic, so they're out in la la land completely. We flip them on their belly, and we do multiple punctures in the back of their pelvis and harvest about a quart of bone marrow, actually. So we make small holes in their pelvis. That bone marrow then goes to our laboratory for processing, and then is directly infused into the patient. In the meantime, Levi has, us having done all his bone marrow harvesting, and will feel like Emil kicked him in the back end for a couple of days. So we give him medications for that. But he's a young guy. The blood cells replenish themselves within hours to several days. The bone heals up very quickly, and he's back off to looking like a normal, regular guy in relatively short order.
So I heard, and tell me if the process has changed, but I heard that giving bone marrow was a painful experience. Not true?
Well, I think Levi can answer that better than I can, but what our patients will tell us is that they are sore for several days afterwards, again, because we've done a bone marrow harvest in the pelvis. However, having chronic pain associated with a bone marrow harvest beyond several days is actually quite rare.
Okay, so Levi, let us have it. How did you feel? Where did you feel the pain? Where did you feel the most pain?
Yeah, he's absolutely right. There was just minor lower back pain, and it was honestly more of just an ache than anything else. Lasted for a couple of days, just when I was like sitting down in a chair, things like that. It was very minor.
Dr. McGuirk, does bone marrow transplants, do they help with anything else that we're researching right now? Do they help cure anything else? Is it just the blood cancers?
It's not just the blood cancers.
Tell us
so
more.
There's a broad array of blood cancers, leukemias, a disease called myelodysplastic syndrome, lymphomas, cancers of the lymph system, multiple myeloma, a broad array of blood cancers for which transplant is indicated and the best possible therapy for our patients in an attempt to cure their disease. But there are other diseases. Children who are born with genetic diseases can be treated effectively with stem cell transplant. Patients who have bone marrow failure, where actually the bone marrow just stops working for complex reasons, it stops working and making blood cells in the immune system, that obviously is life-threatening immediately. So a standard of care, particularly for young patients in the United States, is to undergo bone marrow transplant to rescue them. If they don't have a blood cancer, sickle cell disease is curable with bone marrow transplantation. And so it's quite remarkable. And very importantly, the affected community, principally in the United States, as African-American community, are not really well aware that bone marrow transplant is a curative treatment approach for them. We find a normal, healthy donor who makes healthy red blood cells in contrast to the patient who can't make those blood cells. So sickle cell disease has come to the forefront as an indication for bone marrow transplant. We performed at University of Kansas the first such a transplant in the state of Kansas in a young lady who went on to become a nurse. We transplanted her many years ago, and she works in our system actually, taking care of patients. It's a really another compelling story like that which Levi is telling us today. Just so many neat stories for patients. So no, there's actually a broad array of diseases for which bone marrow transplant is indicated.
So you already said it, but say it again. What is the bone marrow? What is inside the bone marrow that we need?
The bone marrow is populated by a cell population called hematopoietic stem cells, a fancy term for stem cells that are kind of like queen bees in a beehive. They give rise to daughter cells that turn into red blood cells that carry oxygen to our tissues, platelets that help us stop bleeding when we cut ourselves, and the white blood cells, of which there are many different types that make up our immune system and allow us to fend off viruses and bacteria, parasites, fungi that we have to deal with our whole life long and keep us healthy. COVID, SARS-CoV-2, our ability to deal with that. Those cells all entirely come from the bone marrow. So bone marrow is absolutely critical for survival.
Working behind the scenes, things
Absolutely.
that we don't know what they're doing, but it's vital. Okay,
That's right.
I want to get to some community questions. And Ashley wants to know, can you only donate once or can you donate again?
No, you can donate it again, actually. And there are specific time intervals around that the National Marrow Donor Program requires before you can donate again, but you can donate a second time. As a matter of fact, it's not a rare circumstance for us to go back to a donor and ask them not just for bone marrow stem cells, but sometimes their immune system cells called T cells will start dropping, and that can increase their risk for relapse. And so we'll go back to a donor sometimes like Levi and say, geez, could you give us some lymphocytes from your blood? It's not a bone marrow harvest. We just take blood, we collect those T cells and give them to our patients to help prevent them from relapsing. Sometimes a donor like Levi ends up being a perfect match for someone else. Some child with acute leukemia.
What are the odds of that happening? You're on this worldwide, registry.
Yes.
The fact that you match one person, that's got to be really remarkable if you matched another.
It is quite remarkable.
So I want to talk, well, I'm going to ask one more question, and then I have a couple questions for you about Be the Match. But Isaac wants to know, I know that transplant patients have to take immunosuppressive drugs. How well do the vaccines work to protect them from COVID? How about the donors? Are their immune systems impacted?
Yes, very, very important question. Is that for Dr.
Both of you.
I'll let you go first.
Yeah,
Yes.
you go first.
No, it's a major concern, has been a major concern for all of our transplant programs across the nation, not just bone marrow transplant, and certainly, yes, bone marrow transplant, but our solid organ transplant patients as well, because they do receive drugs that suppress the immune specifically to prevent these interactions I mentioned earlier, graft rejection or graft versus host disease. And those drugs diminish significantly the ability of our patients to mount an effective response to vaccines. We still vaccinate them because some of the cells will respond and they will have some level of protection, hopefully. However, those patients have to take extra steps and continue to be extra careful, including during times like we're in right now where we're seeing this great decrease. We're still telling our patients that they need to keep it up. Now, bone marrow transplant patients, after a number of months, can come off those immunosuppressive drugs, in contrast to solid organ transplant recipients who stayed on them for lifelong. And that's a good thing because then it allows them to mount a more effective response. But I'll let Dr. Hawkinson answer.
No, I think that's a great question, and it kind of also goes to a question that we talked about, that we had yesterday about Paxlovid in vaccinated persons. Dr. McGuirk and I were actually talking about this right before the show started, I think it is important to understand who you are individually, what your health is, and discuss that with your medical teams, because we know that in certain populations, vaccines don't provide that that boost to give that immune response as well in other populations, and certainly the populations that Dr. McGuirk and his teams work with, we know can be immunosuppressed, even though they are vaccinated probably 3 or 4 times, again, because they would be considered immunosuppressed. So we did discuss this, and he would probably be more likely to give his patients, even though they're vaccinated, Paxlovid. We do know that Paxlovid, in that New England Journal of Medicine article, was for in unvaccinated persons. However, the only really stipulation in the emergency use authorization for Paxlovid is those that are at high risk of progression to severe disease. And so even though, say, Dr. McGuirk's patients or some of our physicians that deal with solid organ transplants, as he was talking about, who remain on immunosuppression, even though they've been vaccinated, are still going to be fairly high risk to progress to severe disease, so they would be getting Paxlovid as well. And so I think now, but that is great, continue the infection prevention guidance, understand those situations that you're going into. You can always wear a mask, do that, do the preventive measures with vaccination as well. And more than likely, if you are on immunosuppressions, and you need to discuss this, again, because we're getting into individual health here, discuss this with your medical teams, but you are probably going to be getting Paxlovid as well, because you would more than likely be considered high risk to progression to severe disease. And again, there is a continuum there. There is a spectrum of those that may be at severe risk. And so I think that was a good question, and that does play into some of our questions, one of our questions from yesterday as well.
Dr. McGuirk, I know that Levi does not fit into this category, but did COVID keep people from donating? Did you see any shift in numbers? What has been the impact?
Absolutely. It has been very impactful. We collect stem cell grafts from around the world, and KU actually sends stem cell grafts to other corners of the world. And so as this has swept through the world community, it is always possible for a donor like Levi, for goodness sakes, when patients started chemotherapy and radiation therapy in preparation for their transplant, we're destroying their immune system, and then God forbid Levi develops COVID before he's given the donation, and the week before he's given the donation. So we've actually had gone to a system whereby we collect the stem cells beforehand, we cryopreserve them or freeze them in the laboratory, which is not harmful to the stem cells, so that if, for goodness sakes, if something happens to the donor and they develop an illness, we have the stem cells to move forward with the transplant. And so that was implemented worldwide.
Was that before COVID?
No, that was after COVID.
That was because of COVID.
That was a response to COVID.
Yeah, during a pandemic, not a great time to mess with people's immune systems.
That's exactly right,
A question from Georgie Ann. She wants to know, how are donors' expenses paid? Transportation, are they all taken care of?
Yes, the National Marrow Donor Program coordinates all of that, and the recipient's insurance company pays for the donation process. So it's actually very well oiled, so that there's the donor is protected from incurring any financial cost. And they should have paid for Levi's flight and stuff. I don't know if they paid for that scooter or not, but they should have.
Yes, we need a reimbursement program for you. Yeah, they're already giving enough. They don't need to give any more than what they're doing. So this is great. So Amy wants to know, she does plan on clicking on the Be the Match and finding out more, but is there anything specific you should just know off top, just some easy things that might keep you from donating or might make you a good candidate for donating?
Absolutely. There are certain disorders that would preclude a patient from donating. People who have an active infection, for example, HIV or hepatitis viruses. People who have disorders of their immune system, rheumatoid arthritis, lupus, disorders such as that, or bleeding disorders. People who have had recent brain surgery. There are specifics, and that's available on the website for the National Marrow Donor Program to take a look at that. We also collect donors, as you mentioned earlier, 40 years of age and less. And that's not to be discriminatory against older folks, because we have collected people.
What are you trying to say, Dr.
Up to
McGuirk, about me?
60 years of age. You're not 40 years of age.
Yes, I am. I'm over 40, so I can't do it. I was so disappointed to find that out.
So, and the reason for that is that the younger stem cells have a more replicative potential to populate and grow the new immune system. We've learned that over the years. And so we've changed that that requirement to 40 years of age and less, and even preferentially 35 years of age and less, but you can be a donor up to 40 years of age.
Is there any specific type of person or demographic that needs to step up, because we need more of those people in the registry? If there's somebody listening that is like, oh, I'm that person.
This is such an important question. I can't emphasize this enough. When we look at your chance of having a match in the unrelated donor registry, if you're Caucasian of Western European descent, your chance of having a match is actually quite good, about 75%. And that worked for Levi's recipient. However, if you're African American, your chance is about 20% to 25%. If you're Hispanic American, it's about 35 to 40%. If you're Native American, it's about 15%. If you're a mixed race couple, my wife is Chinese, I'm Western European descent, the chance, if my 23-year-old, God forbid, if he had leukemia and needed a transplant, of having a match is almost 0%. So we've got to get more people who are underrepresented in the registries into the registries. African Americans, Hispanic Americans, mixed race couples, Native Americans, we've got to get these folks recruited into our registry so that people in need of ethnic minorities have access to potentially life-saving stem cell transplant.
I do want to go back to what you said, because you have mixed race couples, you and your wife, you have one son, so there's
That's
no
right.
sibling.
That's right.
So that doesn't help.
That's correct.
But so where would you go? What kind of person in that situation would be a best potential match?
Another excellent question. And so we have developed alternative donor transplants. When we don't have a matched sibling or we don't have a match unrelated donor like Levi, we can do umbilical cord blood transplants, and our center performs those for many years, and mismatched family donor transplants. So you mentioned earlier, using mom or using a child of a patient. Again, these are more complex transplants, but they certainly can be successful. They have clearly improved access to allogeneic or using someone else as a donor stem cell transplant for these patients in need.
Sue asked, is there an age limit to donate? And Dr. McGuirk had just mentioned that is it no one over 40? Are there ever any exceptions?
It's no one over 40 years of age going into the registry currently. There are people over 40 years of age in the registry who registered back when it was up to 60 years of age.
Right.
And those people will age out, and when they turn 61, they're automatically dropped from the registry.
That was someone else's question. Do you get an alert if you've dropped out and do you need to re-register? Like, let's say you were, so you just, at 61, you're
Yes,
out.
you're
I
out.
do it at 20, at 60, I'm out. And
That's right.
But here it'd be 40.
Yes, that's
Now
right.
40 and you're dropped out. Okay. We may have a couple more
No,
questions.
the 40-year of age, the people greater than 40 years of age are still in the registry. New people can't
But not
come
the
in
new
unless
people.
they're 40.
Correct.
That's right.
Okay, gotcha.
Yes.
Good to know. Okay, so if we get a couple more questions in, I'll ask you, but we're going to get to final thoughts here in just a couple of moments. But I want to ask you, Levi, in the story that you and I did together, you were writing down some words in the letter. So is the letter that you were writing down and documenting throughout this process, is that the one that you sent to your recipient?
Yeah, it is the one.
So what was that like to get a response back? Because that doesn't always happen. Dr. McGuirk, I'm sure some people do reach out and they don't reach out back.
Yes, I think that there are sensitivities around that, and that's why the National Marrow Donor Program has these important time frames. Let things settle down a little bit, and for people to think about it. And people have personal reasons.
Absolutely, yeah. Everybody has their reason if they want to meet a donor, and some people don't want to. But I'm so hoping that we'll be able to do that. What has this experience been like? Would you do it again?
Oh, absolutely, I would do it again in a heartbeat. It's honestly been a very, easy going experience. I don't really have any regrets at all. It was very, for one, I even got to see Kansas City, which that was on the bucket list.
Okay, what was your favorite thing here? I know you
oh.
did barbecue. What did you do? What was your favorite thing? What'd you see?
Ooh, Q39. That was
Good.
so good. Oh,
It is
I loved
good.
it. It was a recommendation I got right after I left the hospital. We went straight there.
Well deserved. And then you guys just kind of kicked around. You guys went downtown and kind of just took in some sights, right?
Exactly. Yeah, I actually have a friend that lives down there, so he housed us for a night too. So that was really, it just worked out too well.
Well, we just appreciate your dedication, and we love your story. And we are going to keep following your story. You know I'm going to keep bugging you. I text you all the time. I'm going to keep bugging you and find out how you're
Sure
doing
do.
and what you're up to. So I do want to get to some final thoughts. And Dr. McGuirk, I'm going to start with you. Just what you want people to know about what Be the Match means to you, your patients, how important it is to just check out the registry, see if you qualify? What do you want us to know?
Hundreds of thousands of lives in this nation have been saved over the decades through the kind, altruistic generosity of donors like Levi. Hundreds of thousands. And you know there are collateral effects from that. Mm-hmm. Those folks are attached to families and neighbors and friends. And so that means it touches millions of lives and impacts them in ways that the donors will never know, but they should use their imagination to understand that they've had an enormous impact, not just on an individual patient, but on their family and their communities. So no more heroic gesture could be had or requested of someone. It's really an incredible effort. And then my final closing thought is, again, to emphasize that we really need to improve access for ethnically diverse populations. So very important. So many people are underserved and miss out on potentially life-saving therapy because they don't have an available donor.
So are you saying that, I do want to go back to one thing you said real quick, is when you said those percentages, 20%
Yes.
for African American, Hispanic 35%, is that
Yes.
because you that's your donor? So a black person has to donate to black, white to white. Is it not? Is it
No,
like
no,
that, or is it just okay? Help us understand that
it's
part.
It's more complex than that. But if you are African American, if you're of an ethnic group, there is a statistically increased chance that if someone of African descent is in the registry, that they'll have
just a
an
better
appropriate
chance,
match,
a better
chance.
match.
But certainly, the ethnically diverse populations, we all share a lot of these molecules that we are typing for, and so it's not uncommon for us to have an African American donor in the registry who's a donor for Caucasian Western European descent, or people who, because we are all intermixed after all.
Really? No kidding.
So it's just increasing the statistical odds.
And just helping.
Yes.
And I think kind of like what Levi said, what else are you going to do during COVID? He was trying to find a way to help, something to do. What better than to donate through this registry? But I like that being your final thought, because if somebody's watching and has one of those unique backgrounds, demographics to really jump on, this is a chance for them to really help out.
Absolutely.
All right. Levi, just your final thoughts. I would assume you've become quite the advocate for Be the Match, and you probably answer a lot of questions about it. What is your message as we head out this weekend? What do you want us to know, and how can we be more like Levi?
Honestly, it was so easy. I just highly recommend that anyone who gets the chance to do it, please do it. It honestly has given me a very different outlook on life afterwards. Realize just like how much of a difference you can actually make. And I mean, Be the Match honestly made it really easy. They made no expenses, nothing like that. And they even got me one of my favorite hoodies now. So wear that thing all the time. It's got my date engraved on the side. I absolutely love it.
Oh, that makes me
cool.
happy. And just dawned on me in the story we did together, you were thanking your recipient. Whereas you'd think it would be the other way around. The recipient thanking the donor. You were thanking them for allowing you to do this, to change your life. So that's very impactful, and we appreciate you so much, Levi. Have a great weekend. We will be in touch, my friend, okay?
Thank you so much.
See you soon. All right, Dr. Hawkinson,
Yeah.
finalize this show and send us home.
Yeah, I think I'm not going to dilute our thoughtful and impactful messages from our guests. I would certainly second those and endorse them. Great messages, great things to do. Go out and donate. Try to get on the donor panel so you can donate blood, bone marrow. But also, we also know you can donate simply with blood, and we know that Community Blood Center is short on blood as well. So there's a lot of opportunities to go there, and I would just echo what our guests have said.
I'm glad you brought that up, because
Yeah.
you and I are just simply too old.
Yeah.
I hate to say it. We're too
Yep.
old to donate, but we can do blood. So I like that. Thanks
Yeah,
for reminding
absolutely.
everyone. Okay, thank you so much for being with us today. Don't forget, you can catch our shows anytime by logging onto our Facebook page, our YouTube channel, and now on Twitter. Coming up Monday, protecting you and your family from COVID and all the other viruses out there. We're going to talk with health and travel experts about how to get back to vacations safely. That is Monday. Before we go, we want to introduce you to baby Barr, 7-pound, 2-ounce Liam William Barr, that is. He is the son of proud father, Dr. Nathan Barr, one of our infectious disease specialists here at the health system, and a frequent guest on the show when Dr. Hawkinson's out. We're happy to say baby, mom, and dad are doing well. And Dr. Barr, special congrats, and lots of luck getting sleep now when you got 3 kiddos in the house. All right, one more birthday for today. From one birthday to another, our morning medical update staff, one of them is turning 40, the big 4-0. We want to celebrate Cliff Irwin's big day, and we wanted to do that by gracing him with our beautiful singing voices. So enjoy this, kind of, and have a great weekend, and we'll see you Monday.
Happy birthday to you. Happy birthday to you. Happy birthday, dear Cliffy. 40, 40, 40. Happy birthday to you.